Right. Brilliant. If everyone could mute themselves for the meeting, that would be great. Thank you very much. Brilliant. Thank you, everyone. Welcome to this public session of the Oversight and Engagement Board for Friday, the 18th of September. I have the time at 10:16. Thank you again for joining us. Apologies, we had some apologies for the earlier meeting. I won't reiterate those, they'll be minuted anyway. So we come straight to item number 2, which is the minutes from the previous meeting of the public session. I'm assuming that everyone is happy with those and will sign them off as read. Thank you very much. So we come very quickly to item number 12, sorry, which is the summary of local surveillance data. And today we're joined by Rosalind Harris and Rita Elkir, who I think Rita will be doing the presentation on this. If we could share the document, that would be very helpful, I think. But if not, then don't worry too much. But Rita, it's over to you for that.
Thank you very much. And I guess I will try to summarize as much as possible. There is the data is available in the presentation as well as in the weekly surveillance report which we put out. So from this report, we can see that we're still maintaining the message on the front page, essentially that there are increasing cases in Northampton, Corby, and Kettering, and of course the government guidance now has gone live. If we just quickly go to the rule of 6. I guess we don't need a lot of details on that, but just to note that although there are, it seems here simple, 3 bullet points, 4 bullet points, there are lots of details underneath it. And colleagues, police and EHOs are still trying to work out the details, but the key spirit of the rules is that to make sure people our citizens are really engaged as much as possible. The more we do at this stage, the more we reduce the probability of contacts and passing of the infection, especially that we might not know, not everyone knows if they are infected or not. So being safe is better than being sorry, I guess. We still have reductions. If we go to the next slide, please. Next slide 4. As that comes to, you'll see in slide 4 that we have still the areas of concern and enhanced support in Northampton and Corby. Kettering has been taken off the watch lists, and although the national team have been seeing increase, the other areas have surpassed us in a sense, and Kettering is still off that list. This, of course, offers us, this status offers us locally more support, especially around testing, although there is, of course, all the issues about testing, which we'll speak about later. And the incidence rate in the borough of Northampton have been increasing, as we said, for a few weeks, and especially since last week. And for the week ending 6th of September, we're at 31.5 cases per 100,000. And this is one of the highest the Northampton is highest in the county, but there are many other areas nationally which are much higher than this, especially in the northeast. We're still surrounded by areas of concern like Leicester and Luton, and this of course increases the pressure on areas in the middle Northamptonshire. If we go to the next slide, please. In the next slide, 5, we will be talking about public health measures, and we're asking all residents to follow the additional behavioral measures, especially the rule of 6, as we mentioned, and this is to avoid either an early lockdown chosen by our local councils or local council if we do not see there is abidance by those rules, or there, which might also happen, there might be a national direction for areas that have high incidence. So this is a really key message that we want to share with the public. It is down to each and everyone's responsibility to take precautions, to take the rules seriously, and every contact avoided will be a reduction in the possibility for the virus to be passed. And as such, we still continuing to restrict multi-team sports and gatherings, especially with the new rules, and we also continue to restrict visiting to care homes. There are some allowances for end of life and some of the other exceptional circumstances, but care homes are one of the key elements to be protected, and we are always thankful for our residents to keep to those rules to protect their loved ones. And of course, reminding residents regarding face coverings, especially in transport, where some people might not have been abiding by that, and in closed public spaces, car share should be reduced as much as possible, but if this happens, leaving the windows open and face coverings is key to reduce transmission, because we have seen that happening in too many of our outbreaks. Recruitment agencies are reminded to workers must be associated with one particular workplace to avoid this cross-contamination. Schools and colleges and universities have returned. There's a lot of intensive work to ensure safe return, but this is an area of continuous watch, and we will be informing the public, and will continue to inform the public on how to keep safe. Next slide summarizes these, slide 6 summarizes how the key messages are still there, the 2-meter rule, but also keeping to households, and of course the rule of 6 reinforces that, and this is especially to reduce airborne aerosols, but of course also sharing items. The virus still passes through contact with contaminated surfaces, so washing hands is still a very important protective activity. If we go to the next slide, this is about the next slide, 7, about the test and trace and the testing activity. This has had some problems recently, and we'll speak about that later. Slide 7, please. There is a availability of the testing starting, although reduced, but still available, and especially if people book at 6 p.m. When the slots are released. We need to remind our residents that actually this is open to nationally, so people can book from other places, and we cannot reserve it to our local residents, but we encourage people to go to the website repeatedly, and especially at 6 p.m. when these slots are released. Everyone who has symptoms need to get a test. Even if they fail to get a test, they still need to isolate as well till the test results come back. They need to isolate. The sooner the test results come, of course, then the tracing can start. If we go to the next slide, please. Slide 8. And we'll see in slide 8, when it comes up, the rates are following the green core, which has that long bar it still remains high. It has come down from that previous, that older week, but we still have the trend line on an increase in terms of the tests and test results. We need our residents to be conscious of this increasing trend, and we'll see more of this in the coming slides. If we go to the next slide, 9, we will see this breakdown of the testing in slide 9. The Pillar 1 and Pillar 2, reminding that Pillar 1 is mainly focusing on hospital settings and NHS front staff, although increasingly now where these two pillars are being mixed up simply because of the prioritization of testing to more of the frontline and the hospitals and care homes. Some of the Pillar 2 testing capacity is shifted, and the facilities are used for both. But overall, we're still seeing a focus on or a more preponderance of the younger age groups, and this probably reflects the mobility of these groups, working population. Care homes and hospitals are still on the lower side of the number of cases in the older age groups especially, although we're seeing also sustained increase, although not to the same yet to the highest levels we have seen before. And if we go to the next slide, slide 10. Slide 10, looking at the total cases by district and borough. The red arrows shows the trends from the previous week, and we can see the red arrows now for the whole of Northamptonshire. This has been a continuing increase. We also see it in most of the boroughs and districts, except for Corby and Kettering. Need to note that Corby still has higher rates. They have reduced a little bit, but we're still seeing this overall increased trend. And if we go to the following slide, 11. In slide 11, we will see the total cases to date by the districts and boroughs, and this is a cumulative rate. In future, we'll show also a weekly or focused rate for 28 days, but still on this cumulative rate, we can see that there are significantly higher levels for Corby and Kettering and Northampton. And although the absolute figures themselves might, because they're cumulative, might not show the same or reflect the most recent trend, but the significant higher numbers of cases still remains in these areas. If we go to the next slide, slide 12, which is a graphical representation, slide 12. This is cumulative cases, and because this is total number of cases from the beginning of the outbreak in February and March, we can see that the numbers instead are still steadily increasing. They are not flattening as we would like to. And if we go further on to the following slide, 13. Slide 13 will show us the daily lab confirmed cases, which is more recent representation. And after the huge jump in Northampton cases and Northamptonshire overall after Green Corps, rates have stabilized, but then started to go up. And the overall Northamptonshire line has been steadily, although gently, moving up, and it has merged now with the whole England rate. So now we are at the same level as England, this is because England overall has increased more rapidly than Northamptonshire. Now Northamptonshire overall is at a similar level, or even sometimes slightly lower. But we still see Corby, although has reduced over a couple of weeks, then increased, started to increase again. Other areas are also increasing, especially Northampton and to some extent also the Kettering and Wellingborough. The more recent data that we will see that there is overall, all the lines are slightly, though slowly creeping up. If we go to the next slides, there are a series of 4 slides from 14 onwards that show the geographical distribution. Slide 14, please. I will not go into the details of these 4 slides coming, but they are self-explanatory in terms of the areas with a higher number of cases over the last 28 days. These are MSOA, so they do not directly translate into wards, but they roughly show the areas where we have more concern. And what I would say about these is that we follow these daily in meetings with our local districts and boroughs and environmental health officers to make sure that actions directed to these areas to support them and reduce the transmission are taken promptly. Yet we can see that still there is some areas are repeatedly occur, and this is probably reflects some of their location, either because of their businesses there or center of towns, and some in Northampton especially might link to some of care homes as well, and similarly in other boroughs. If we go to slide 15. In slide 15, we will see a similar picture, slide 15. A similar picture also, but this is using rates rather than just a number of cases. Slightly changes the picture, but a combination of these two slides, 14 and 15, will give local residents and businesses a good picture of where their area lies in this in the preponderance of cases, and where these are higher, even extra precaution is required. Overall, these higher areas, as we said, are focused on the towns and cities, Northampton, Kettering, and Corby, but some of the darker shaded are also in other districts and boroughs. I'll skip slide 16 and 17. They show just the cumulative case rates and a similar distribution. If I can go to slide 18, please. Slide 18. And here is a summary of outbreaks and exposures broken down by districts and boroughs. I think the overall picture still remains that we have a number of outbreaks in care homes and workplaces of concern. This is over 28 days, and there is still an impact from the Green Core figures on the workplaces. So still have 337 cases there because it takes that period to be removed from the register. And if we extract the Green Core, we will have about 200 to 300 less. Yet we still have to consider that the smaller outbreaks in other businesses is happening in several of our districts and boroughs. Care homes as well is there are some additional outbreaks, although the majority of these are in staff, and they're quickly controlled. Any staff member who gets a positive test isolates, and their contacts are traced. So they're given priority in terms of testing and in terms of management. There is additional support to care homes in terms of funding and infection prevention control to make sure our loved ones in care homes are protected and nothing happens similar to what happened before. Exposures just is a category that reflects one case in any of these settings, but the numbers as well are higher than we would like to. But overall, a stable picture to some extent. If we go to slide 19, in terms of ongoing public health actions on slide 19, they are still continuing on a similar pattern, although we are intensifying actions across these areas, and we are seeking more and more engagement from our local residents, especially where we now with the new legislation and the new powers, if areas or people or institutions, venues do not abide, there are going to be stricter penalties, and also possibly if things don't go continue to increase, we might have local lockdowns or local restrictions, and to avoid these we need everyone to engage. On slide 20, these are continuation of these actions, and we will be continuing also engaging with the media and our businesses to make sure we communicate effectively with our residents, and make sure also that any restrictions are only effective and targeted. So for that reason, we'll still be continuing with the limiting of sporting and formal events with any large numbers, and also be guided by what Northamptonshire Health Protection Board and the local Oversight and Engagement Board directs in terms of protecting the public, which is the key outcome from all of these. For the next slide, there is a contacts that we encourage people to use in terms of contact with local EHOs if there are any concerns or reporting of incidents that breach their guidance. Thank you very much. I'll stop here, and Rosin will bring in some more of the tracing and the testing outcomes.
Thank you very much, Rita. I should have said at the outset that Lucy Whiteman, our hardworking Director of Public Health, is having a well-earned rest and has been ably substituted by Rita and Rosin. So I should have said that at the outset. Thank you very much for that, Rita. That was a very thorough run through of the local situation. I'm looking around the room to see if there are any questions, but I think there aren't any. Therefore, I'll move to Rosin to give us a testing update. Sharon Wright was due to do this, but she's been called off to have a national meeting. So Rosin, if I could come to you on testing update. Thank you, Rosin.
Thanks, Councillor Morris. And as everyone on the line, I'm sure will know, there has been a real problem with access to testing nationally over the last couple of weeks, particularly since schools returned, when demand for testing shot up significantly. And those lab capacity issues, because that's the real bottleneck, is the slots in labs to process the samples, has required us to put a sort of limit on the number of appointments that we make available in the county, to make sure that there aren't swabs that are sort of discarded in the labs because they're sort of languishing there for days on end. So we're trying to match appointments to the lab capacity that's available. Just to reassure that in terms of the number of tests, number of appointments and number of tests that are taken in the county, we've compared the last 2 weeks, so from the 1st of September to the 15th, in terms of numbers tested in the county, compared to the previous 2 weeks, so the 2 weeks from mid-August to the 1st of September, and there's no difference in the number of tests that we've conducted in the county. The issue is that the demand for tests has increased significantly. So it's not that we're testing fewer people, but that the demand has increased. Those number of tests include both what we call Pillar 1 tests that the NHS conducts in hospitals and for care home outbreaks, as well as Pillar 2, which is the commercial solutions and our mobile testing units. What I should say is that there is a testing strategy for care homes, so that our priority is really those most vulnerable residents, and care home testing strategy is that all care home staff are offered tests weekly, and all care home residents are offered tests monthly. So a lot of those outbreaks that are popping up relate to that testing, regular testing of care home staff and residents, identifying potentially asymptomatic residents and staff. So that is a priority to continue, and that has seen sort of capacity for testing of the wider population reduced. So I know a lot of people struggling to get appointments. The real key messages, I guess, are if you have any of the symptoms, you absolutely do need to get tested, but the key thing is to isolate yourself. So that's the thing that will have the biggest impact on reducing transmission, is the isolation. And of course, testing is really important so that we can then do the onward tracing, but the isolation in the first instance is key. And I don't know if I should pause there for any questions before moving on to the test and trace, the contact tracing update.
Yes, I've got one hand up. I've got, before Chris asks his question though, I think we were looking to create some extra lab capacity somewhere in Loughborough or Leicester. I can't remember exactly where it was. You might want to comment on that as well, because obviously that shows that we're trying our best to increase the testing, the testing within the labs, as it were. Chris, over to you.
Thanks, Ian. And just picking up on Russin's last point there, which is around when people should present for testing. And please correct me if I've got any of this wrong. I'm happy to be told when I'm wrong. My impression has been sort of in the run up to perhaps the last couple of weeks that the message was maybe something along the lines of, if you're concerned that you might have the virus, please go and get tested. Whereas now we're saying, if you are exhibiting symptoms, please go and get tested. There's a subtle difference in the message there. And obviously, you know, if it's only people who actually have symptoms who present for testing, then that may help to reduce some of the pressure on the system. So there's clearly a message to be got out here, and you know, which reinforces when people should go and get tested. I suppose the issue then is about self-isolation. So is it, and I'm a little unclear on this, I'm sorry, regarding self-isolation, is the message that you should self-isolate if you have symptoms, or is the message you should self-isolate if you think you've come into contact with someone who has symptoms? And that may be causing a confusion. So if there's any clarity that can be given there, I think that'd be really helpful, Ian. Yeah,
absolutely. Can I offer clarity on that that point first, and I'll come back to your initial point. So yes, absolutely. The advice is you should isolate if you have symptoms, or if you're in a household with someone who has symptoms. So if you think you might be a contact of someone who has symptoms and not yet confirmed positive outside of the household, you don't need to self-isolate until that's confirmed. So that's the distinction between if you have symptoms and or someone in your household does, if you live with someone. But otherwise, if you're a contact, you don't need to self-isolate until that is confirmed. That's just because of the level of risk, the likelihood of a contact being infected when your household member is much higher than a contact outside the household.
Thank you for that, Rosin. That was very, very helpful. I've got Phil Bignell as well with his hand up. Oh, you wanted to comment?
I was going to.
Oh, sorry.
Oh, sorry. I just realised there was a previous point, and that was around the change in messaging. And yeah, absolutely, that has been a change in messaging, and we are getting anecdotal reports that there are still people who are following the previous messaging of anyone who's concerned. So anyone who's concerned they might have been a contact of someone who's developed symptoms coming for testing, but the messaging now is very much it's only those who have symptoms. So if you're a contact, you don't need to get tested until you develop symptoms yourself. And that should ease the pressure. That should mean that we're prioritising those who are symptomatic, so that we can manage that the issue with capacity.
Thank you, Rosin. And then I did reflect on the lab capacity as well, but perhaps you could mention that after Phil's asked his question. Phil.
Yes, thank you, Chair. I mean, my recollection of last week's meeting that we were told that 35 out of 50 lighthouse labs were going to come on stream. Is that how I understood it? The figures nationally doesn't seem to reflect those. I mean, I don't know what happened to those 35. Did they come on or whatever? I just like a feedback on what I believe we heard last week, please, Chair.
I'm afraid I'm going to have to defer the questions to. So I know that Sharon is working on sourcing additional lab capacity in the county and liaising with. In fact, that's why she's not in the call at the moment, because she's on a call around national lab capacity. So I'm afraid if I could, she's the expert on this, so I wouldn't want to give an answer that's not the latest information. Would it be okay to get back to you once we've liaised with Sharon?
Be lovely. Yeah, it'd be excellent. Thank you very much indeed, Chair.
Come back next week with some answers to that or before, and then we can share the information. That would be brilliant. Thank you, Rosin. I'm looking around. I don't think there's any other questions. So we'll come on to the communications and engagement update, and we'll go to Sarah for that. Sarah, hello, Sarah.
Morning. Okay, so since June this year, the COVID-19 communications cell has completed and logged around 270 actions in a bid to communicate to all audiences across the county. Our proactive and reactive media work, press conference, social media scheduling, surveillance data pack and website activity is in addition to this. The outdoor cross-county advertising campaign, you've probably noticed, came to an end on Sunday. And before we commission any further advertising and paid for assets, we're currently reviewing how effective all our communications has been to date. I'll go through some data and stats with you shortly. We also now have the results of the COVID-19 Northampton Community Survey, which will inform and offer insight into further comms activity. The focus this week has been very much around testing. We've paused the twice daily updates on local testing availability until further notice, given the continuing capacity issues. Instead, we're now sharing a new social media graphic with some key messaging around accessing testing. This directs people to the NCC website if they want further information, as we'll continue to publish details of local testing sites there. Our public health consultant, Rosin Harris, has given 2 radio interviews this week. One talking about the current challenges of testing, and we've dealt with a number of media inquiries in a bid to clarify the situation. In terms of COVID awareness promotion, we've been pushing forward messaging around the government campaign Hands, Face, Space. A select few of the Saints rugby team have made a video for us targeting the 20-year-old upward audience. We're just waiting for that to be subtitled before we can share it on social media. We're also starting to promote the flu vaccine. We're supporting Public Health England campaigns, including the Test and Trace, Better Health, Stay Alert to Stay Safe, and Every Mind Matters. Work specifically targeted at the BAME community includes COVID-19 awareness leaflet in Serbian was shared and distributed in all boroughs and districts this week. There's the continuing translation work into print, audio and video, and ongoing grassroots engagement with the environmental health officers and community engagement officers. We liaise with them directly on a regular basis and react accordingly to provide supportive communications materials. For our younger audience, we're developing a visual text story. We have increased social media and messaging with our hashtag Northants Together. Okay, I mentioned the analysis of activity earlier, so I'll talk you through some of the data results so far. For the geolocate service, which we commissioned specifically across pubs in Corby and Kettering, the service started on September the 5th and ends on the 20th. So I have a mid-report for you. In Kettering so far, the total number of times the advert appeared on a user's screen or the impressions was 31,097, with 70 clicks through to the NCC website and a reach, or a number of people who have seen the advert, of 3,362. In Corby, it was slightly less, or greatly less in terms of the reach. 25,642 impressions, 51 clicks to the website, and only a reach of 309. Once we have the full report, we'll be able to analyse that better. Social media statistics we've got for Twitter. Between the 9th and 16th of September, we tweeted 469 times using the hashtag Northants Together. We had 475 retweets, total reach of 79,530, 5.15 million impressions, an engagement reach of 85%, engagement rate rather, and total mentions 946, which we're very pleased with. The website views, so people we've directed to the website through all our communications activity between the 9th and the 15th of September, so this is last week's figures. Testing locations page 19,242, coronavirus information homepage 3,389, local advice and guidance 522, enhanced contact tracing, the local service 403, 337 to the request for help page, and 200 for the guidance for businesses, which again we're pleased with for weekly figures. That's really quite something. So I'm happy to take any questions on any of the above.
Thank you. That's a very, very good summary there. Thank you, Sarah. And it shows that the comms team are doing as much as they can to help with this situation. In fact, are working extremely hard to get the messaging out there. The question is, are people listening to the messages? But that's a whole different debate. I've got two hands up. I've got David Jones from Health Watch, and Phil, I think your hand was either still up from before or not, but yes, you're ready to ask a question. Good. So David Jones, hello, over to you for your question.
Thank you. Two quick points of positive appreciation, and certainly I see the social media and other things, and that's a very encouraging report, so thank you for that. I would just want to express appreciation for a particular response we've had concerning personal assistance of personal assistants, people who have direct payments. It's a very particular group of people who have a payment from the council, and they employ their own assistants who come in to help them, people with disabilities, people with older people. And this is a group who are quite difficult to identify because they are so dispersed and around the county, but obviously the people who they are helping are very vulnerable. And I raised this a few meetings ago, and I've had a helpful response, and we're following up on that. But it is important that they get help, as well as other domiciliary care staff through agencies and so on. So thank you, and we're following up on that. The other thing quickly is to say that a church that I'm involved with has been using the helpline and has found that very helpful. To phone the helpline and get advice and guidance about churches and places of worship coming back together and what that implies and the rules that are there. But thank you to the team who've been providing that help. It was clear and it was helpful. Thank you.
Thank you, David, for your thoughts on that. That's very good to have first-hand evidence of the comms team in action. I don't think Sarah needs to come back to you on that. That was more of a reflection of the good work that they're doing. So thank you for that. Phil, I'll come to you. Phil Bignall, hi.
Yes, thank you, Chair. It's very impressive figures. There was one figure that I didn't understand was 5.15 million impressions. Compared to all the other numbers, it was just out in left field. I didn't understand what that meant.
So that's the total.
Sarah.
Yeah, that's the total number of times the hashtag appeared on a user's screen.
Okay,
So
thank you very much. Yeah.
Yeah.
It just seems so out of kilter with all the other numbers, and there was like
Yeah.
millions of them. Thank you, Sarah.
It shows we are reaching our target audience, I guess, is the answer, is one answer that we could give to that. Thank you very much for that, Sarah. I think that's probably it then. So we've got any other business. Did anyone have any items under any other business? Roslyn, did you want to say anything under any other business that we haven't covered?
I think just any other business item that I wanted to raise was around the NHS Test and Trace app that's going to be launched on the 24th of September, so next Friday, to make everyone aware that nationally there's going to be a campaign promoting this app over the weekend, so look out for that, and we'll be sharing messages promoting that campaign from next week onwards. So any communication channels that you have open to, if we can ask members and anyone else that you're in touch with to share that messaging, that would be really helpful.
Certainly will, and if you get something out to all councillors, we will of course spread the word for you if we can do that. Phil, was your hand still up?
Yeah, no, just a quick one. Next Friday is the 25th. You're saying the 24th?
Oh, apologies, sorry. Have so I believe it's Thursday evening, so people will probably start downloading it on Friday.
Yeah, sorry to be pedantic. Thank you.
Good to have that clarity. Thank you, Phil, for pointing out that. So that's any other business. Our next item is just future meeting dates. We have one on the 25th of September at 9 a.m. It remains for me to say thank you very much, everyone, for coming today. I think it's been a really useful meeting. I'll see you all next week at the same time, same place. Thank you very much. Stay safe, everyone. Have a good day.
Thank you.
Chair, thank you, everybody.